Greetings, well wishes, and salutations. I'm grateful to be part of today's discussion and share with you about healthy parks, healthy people. I can't imagine a better time or a better place, even virtually, for us to gather and to join with these barn-raising, big-hearted Texans by nature and community partners as we explore the health and nature connection. So, one thing I can tell you is that even within the COVID environment, most of our national parks remained open. In fact, even in the face of COVID, in the spring, 96% of our parks had outdoor environments, parks, open space, trails available to our park visitors. We're very proud of that fact. So we promoted our parks as places for people to get fresh air. We continue to do this, places to have physical activity, places that can boost our mood, boost our immunity, and help us prepare for a possible next wave of the pandemic, and even just to weather everything we're going through in these uncertain times. So I just want to pause and give us all a time to think about nature and our health. And I chose Big Bend National Park as my screen background. And I chose it because it is a beautiful park based in Texas. And I thought I could also give you all a dose of nature therapy just as we pause and drink in this beautiful scenery. So take a moment and take in some good medicine. So we all know that even viewing scenes of nature and beauty is good for us. It can help us be stronger, more creative, more productive, and restore our brains and minds so we can focus better, whatever we're doing. So I'm glad we could take this moment to boost our moods. And now that I have your attention looking at Big Bend, I'd like to use Big Bend National Park as an example for all of us as we're moving through the COVID environment. So during the spring and summer, April to June, Park Service employees gathered together at Big Bend, and they examined what they could do to give back to the park even when the park was closed to visitors. So while the park was shuttered, they all found duties and ways to give back to the park so that it would be better when the park visitors can return. So some of the activities that happened at Big Bend this spring during the time of stay-at-home orders, the park was busy painting signs in the park, building stairwells and stairways in the park. They were busy repairing roofs. They were busy doing prescribed burns. They removed brush. They removed invasive vegetation. And they even did a deep cleaning of the carpets in the visitor center, something that's difficult to do when it's the busy season. So even as the Park Service looks at ways to rebuild during the pandemic and make ourselves better, it can serve as a metaphor as we consider how it is that we can look at our own lifestyles, our own businesses, our own practices, our own institutions, and how can we build back healthier, stronger, and more sustainably. I think it's a question we're all beginning to ask ourselves. So we are 7 months already into a global pandemic. We all want to find ways, I think, to be stronger, healthier, and live more sustainably. I hope to explain now how it is that the Healthy Parks, Healthy People approach and philosophy is one way to do just that. So Healthy Parks, Healthy People is a philosophy and approach that's based on the premise that our parks are cornerstones for people's physical, mental, and spiritual health and social well-being, as well as sustainability of the planet. We have developed a vision and a 5-year plan, and the vision is for parks to help create a healthy, just, and sustainable world. We believe that parks, whether they're urban or wild lands, can serve as health resources to the American public. And based on this fact, we know that our parks have an obligation to the American public to honor the fact that if parks are good medicine, how can we ensure that the medicine is good and available to all? So we began to explore in the last few years, what is a healthy park? one of the places that we can get our cues for this is looking at other institutions and other systems that have been devised based on science, working with the World Health Organization and communities, education bases and academicians have come together. And I think we've all heard of now healthy hospitals, we have healthy schools, healthy cities, even a system for promoting healthy prisons. What do these look like? They look like re-examining how it is that facilities and environments and programs can come together to be more health promoting. Not too many years ago, you could go into a hospital, for instance, and you might not find a healthy meal. You could go into a hospital and smoke on the grounds. These are things that have been addressed through healthy hospitals to ensure that you can find a healthy meal and that you can find fresh air and a place of healing and respite. This would be true for the healthy schools, looking and examining how these places can be more health promoting. In the same way, the National Park Service has been examining how it is that our parks can be more health promoting. So in this way, we do know that we want people to be inspired to improve their health in our parks. We want to better understand if parks are good medicine, how can we ensure that the medicine is good and accessible to all? We also want to provide concrete ideas and examples for park managers and our partners so we can all come to understand how it is that we can see that parks serve as gateways to health. So let's take a look at some of these concrete examples of what works for health. We looked first at the science. We examined some research that has been assembled through the Robert Wood Johnson Foundation's county road rankings and roadmaps for health, as well as what works for health. So looking at the science and the basis of the evidence and evidence ratings, we looked at all the practices, and then we looked at what's happening across the Park Service and did a crosswalk to see what are the practices that we should be promoting? What are the practices and programs in our parks that might be expanded upon? What already exists? So I'd like to share a few of these examples to spark your interest, help you understand how our parks can work towards this healthy parks, healthy vision for parks to help create a healthy, just, sustainable world. So we've organized how it is that we look at healthy parks, and we've looked at programs and facilities and environments. We've looked at programming and organized it in such a way that we can think about how it is that some of the programming can be doctor-led. You've heard about some of these programs already. Examples include park prescriptions, where our doctors are referring patients to get into our parks to promote their health as medicine and therapy. You've heard perhaps of Walk with a Doc, where doctors are actually leading patients on walks in our parks. You might have heard of art therapy programming in our parks, where we're promoting mental health through artistic expression. And you may then know that we've looked at these doctor-led programs. We've also looked and assembled a collection of ranger-led programming. These would include walk with a ranger, bike, run, paddle with a ranger. Beyond that, we've also looked at some community-led programming in our parks. Community gardens are an example. Open streets or ciclovia would be a community-based program. Some more examples are beyond doctor-led, ranger-led, community-led programming are self-led programs. We know that people want to be empowered and authorized to guide themselves to having fun and enjoyment in our parks and get healthy at the same time. So we know that there are some gateway recreational activities we've identified to promote health and well-being. We also know fitness challenges are another aspect of helping self-led healthy activities in our parks be something that we're upholding and offering and welcoming people into our parks to enjoy. So as we look at these self-led programs, I'll do a little deeper dive at some of the fine-grained aspects. Just looking at gateway recreational activities, I think you might be interested to know that there's been some longitudinal studies put forth by the Outdoor Industry Foundation, and we've looked at their research over time, and we recognize now that there are 5 gateway activities to health in our parks, and the 5 that we've identified are activities that have been found that if children and youth are introduced to these 5 activities as children, they tend to lead healthier lifestyles and participate in outdoor activities for a lifetime. So the 5 activities that we've identified as per this information are running, fishing, camping, bicycling, and hiking/walking. What's interesting about these gateway activities is the fact that running is the most popular activity for all ethnicities except white populations, who participate in hiking at higher rates. We think this is really interesting and powerful information as we develop programming to be more invitational to people of color who may be most at need for finding health and healing in our parks. We know that people of color suffer from disparities of health. They suffer more from chronic disease. They suffer more for the risk of COVID. So as we look to be invitational to youth and high priority populations, this is how it is that we've identified and are focusing on these 5 gateway activities, self-led activities in our parks that can be health promoting. Another aspect of health promoting activities in our parks and programming we've identified that are scientifically supported includes healthy and sustainable foods and community gardens. Some of you may be surprised to learn that we have community gardens in many of our national parks. We think this is something that can be expanded upon and promoted nationally. Imagine being able to know a whole list and array of parks where you could learn about healthy eating, you could learn about cultures and opportunities for enjoying a locally sustainable food experience when you're in a park. Another aspect of our community gardens is we've broken them down, looking at the Robert Wood Johnson Foundation's What Works for Health listing of science-based programming for health promotion. In our parks, we have working farms. We have community-supported agriculture. We have kitchen gardens, learning gardens. We have educational programming. And we have, in some cases, healthy food concessions in our parks. So these are ways that can promote our parks as a health resource and also introduce people to sustainable habits and promote social well-being. Many times our community gardens will have a surplus, and there may be programming in place to provide that surplus to food banks in the community. There are also educational opportunities for people to learn about how they can enjoy a healthy lifestyle that includes healthy foods. Sometimes in our parks, there are educational programs in our learning gardens where people learn about pollinators and the importance of composting and how those can all give back to the planet that feeds us. So this is how it is that we've been looking at access to community gardens, and healthy foods in our parks can be another way to advance parks as a health resource. We have a couple of more examples, one being open streets. I think this one is particularly important within this COVID environment, because open streets, or ciclovia, is when we close streets to automobiles and open them to pedestrians, bicyclists, people with strollers, and other forms of active transportation. When we close our streets, we open them to festival opportunities. We open them to safe, sustainable ways that people can enjoy the outdoors in our parks. Open streets is a practice that happens in communities and parks. We have examples where our parks have been closing roadways on a temporary basis, on a seasonal basis, and sometimes permanently. During the COVID times, I think we all experienced when many of our roadways were so quiet. They were practically closed to automobiles, and you could safely enjoy them. We know now that many of our cities are re-examining permanently closing certain roadways and pathways and transportation systems for bicyclists and pedestrians. We think the same could be true in our national parks as we look to reopen. What might stay closed? What might change? Some of these open street opportunities may be a powerful way for us to give back to the health promoting aspects of our parks. And finally, one more example I want to discuss briefly and touch upon is one that is an expert opinion. It hasn't been scientifically supported yet and is an opportunity for even more research, and that would be fitness challenges in our parks. I lift these up because fitness challenges are happening all across the country in our parks and communities. There are ways where we set aside a few programs, and if you check a box or log into an application online on your watch or on a computer, that you can demonstrate that you're participating in a regular, daily approach to connecting with nature in our parks. These fitness challenges often might encourage you to walk in different parks or to paddle in some parks and run in others, to enjoy a camping experience and just to be outdoors connecting with nature, perhaps doing a service opportunity in our parks. These fitness challenges are found in many of our parks, but we haven't organized them in such a way that you can actually know about them or consider getting several patches of honor or badges of honor for accomplishing these challenges. We think that this is a way that can incentivize connecting with our parks, can also help the national parks keep track of our success. So it could be a win-win. So these fitness challenges are just another opportunity that I'd like to lift up today. In addition to these programs, I would be remiss if I did not mention the fact that part of our response to the COVID pandemic is that we are promoting nearby nature. This includes opportunities for people to experience nature from the window, from the backyard, from the neighborhood, and even nearby close to home national parks without traveling far and putting themselves more at risk. So we're promoting this nearby nature in something that we call Parked at Home. It includes opportunities for having virtual park experiences. So it might be a virtual camp out with building a fort with children in the living room. It might be a virtual sing-along, joining with rangers to sing songs around a virtual campfire. It can also include virtual experiences where we come together as a nation and celebrate certain holidays. We celebrated Memorial Day virtually in our parks with interpretive programming coming into people's living rooms and school children learning about how it is that they could tour a park or enjoy learning about a park and the opportunities that they could visit one day when the parks are more fully open. So putting all this to work takes an enormous amount of energy and collaboration. And as we join together in discussion, I'm excited about an opportunity for funding these programs, possibly research, possibly leveraging partnerships. And this funding opportunity just came our way in August of this year. It's called the Great American Outdoors Act. It's a permanent source of funding. It will not sunset. It provides $9.5 billion over the next 5 years. And it also includes $900 million into a perpetual fund called the Land and Water Conservation Fund. Most of these funds are dedicated to repair and rehab of our aging infrastructure. That includes our roadways, bridges, visitor center, our trails. The reason I bring this up is because while the majority of these funds are dedicated to park infrastructure, many of us who are examining the health and park connection know that park infrastructure, these facilities, these environments are in fact health infrastructure. An investment in these resources is an investment in our health. One often overlooked aspect of the Land and Water Conservation Fund is that the original legislative purpose for these funds is, and I quote, to strengthen the health and the vitality of the American people. I hope you'll join with me as we remind ourselves the purpose of the Land and Water Conservation Fund. And as the Park Service looks to maximize this opportunity, I hope we can collaboratively find ways to raise awareness and future opportunities to advance our parks as health infrastructure. And as we do this, I hope that we can look for philanthropic opportunities to leverage these dollars so that we can further advance this amazing opportunity to promote healthy parks and healthy people. Thank you very much.